Hey there. All right, so welcome back to our lecture series. So this is going to be over the organization of the human body. So this is chapter 1 of our lecture series. So let's go ahead and dive into it. This is the very basics of A&P. So we're going to go through the organization and what essentially classifies something as living. So there's 5 different things. There's organization, metabolism, growth and development, and responsiveness, regulation, and reproduction. So technically 6. So with organization, all organisms have to exhibit a complex structure and order. So for that, meaning that things have to be essentially building blocks of each other. Metabolism. So every time we say metabolism, or someone has a high metabolism or a low metabolism, what does that actually mean? So there's actually 2 different types of metabolism. So you have anabolism and catabolism. So sometimes it can be hard to tell the difference. So when I think of cats, they tend to like to break things or tear things apart. So catabolism is actually breaking down large molecules into smaller molecules. Anabolism is the opposite. It's actually building smaller things to larger things. So you might be thinking, when would this ever happen? So think about over the holidays and you're eating a lot more, and then on the new year, you notice that you gained a little bit of weight, or that your clothes are not fitting as well as they used to. So what has happened in your metabolism, it has taken smaller things and built it into bigger things. So essentially all the food that you've eaten, and the sugars that you've eaten, it takes that and stores it, and it stores it as fat. And so you tend to get a little bit bigger. So that's one way. And then catabolism is the opposite, which is breaking stuff down. So let's say that you haven't ate in a long period of time. Your body's going to go through catabolism and it's going to start breaking down that fat, which is a larger molecule, into a smaller molecule for your body to be able to use. So that would be an example of metabolism. Growth and development. So organism, in order for something to be living, it has to be able to grow and develop. So if you think about humans, we start off as this very, very small structure. You can go back to sperm and eggs, and then we become this whole organism. So over time, we actually grow into a bigger organism. Responsiveness is essentially the ability to detect or react to stimuli. So think about it like this. So when you're outside and it gets cold, what does your body do? It gets goosebumps or you start to shiver. That is your body responding to the stimulus. The stimulus is the cold weather or the cold breeze that comes by. Regulation. So kind of going back to the previous one, your body must be able to adjust to internal bodily functions in response to environmental changes. So when it's cold outside, your body is still at 98.6 degrees Fahrenheit, even if you're cold. And if it's hot outside, your body is still at 98.6 degrees. The way it's able to do this is by either sweating or shivering. If you're hot, you're going to sweat so that you can cool your body down. And if you're cold, you're going to shiver, which makes your muscles move and twitch, which is going to make you become a little bit warmer. So your body is able to regulate its body temperature. Reproduction. All organisms that are classified as living must be able to produce new cells for growth, maintenance, and repair. So even if you get a scratch, your body is able to repair that scratch. It bleeds a little bit, and then it's going to become a scab, and then eventually it goes back to where it was before within a few weeks. As for reproducing another child, the body still has to go through meiosis, which is going to essentially help make another human being, versus, which we will call that gametes, and then the regular body cells would be somatic. So those are the 6 things that are really needed in order to be able to classify something as living. So sometimes we refer to as viruses as living, but that is not the truth. Viruses are not considered living because they're unable to do this. They're unable to reproduce by themselves. They must have a host. But we still study them just because it does affect so many living things. Bacteria actually follow all of these. They're organized, they have metabolism, they're able to grow, of course, they are able to respond, they are able to regulate because some can live in high temperatures or low temperatures, and they're able to reproduce, of course. So bacteria are considered living, however, viruses are not. So in order for something to be considered living, they must follow all of these categories, all 6. Now, moving forward, here are the levels of simplest to most complex levels of organization. And this would be a very, very, very key point that you would see all through A&P. Because if you can affect one of these things, you can affect the next level. So starting at the very base level, you have an atom, which is what you see right here at the very end, if you look in your book. So you have an atom, and then 2 atoms put together makes a molecule. And then you have, if you put many molecules together, you get what's called a macromolecule. And then that macromolecule can, if you put several of those together, you can get what's called an organelle, which these is what you are going to see with inside of cells. So like the mitochondria, you know, that's the powerhouse of the cell. That's an organelle. The plasma membrane is an organelle. The lysosomes, the nucleus, those are macromolecules put together, which make an organelle. The next higher thing, if you have all those organelles put together, is going to make a cell. That's why you see it going here. If you have several cells put together, it's going to make a tissue. If you have several tissues put together, at least 2 or more, you end up making an organ. And then organs put together makes an organ system. And then organ systems put together make an organism. So this is the hierarchy of living things. So the reason why this is so crucial for you to understand is because if you can affect one of these, you can affect the next. So if you can affect cells, so think about when you get sick or the flu, that flu or that virus is taking over a cell, just one cell. If that one cell can affect other cells and more cells, all those cells can affect a tissue. And then that tissue can affect an organ. That organ can affect an organ system. And then eventually it can affect the organism and potentially even cause death. So this is a very, very crucial thing that you need to understand from here and all the way through A&P is the understanding of the hierarchy. If you can affect one of these levels, just any one, you can affect the next one and the next one and the next one that could eventually cause a lot of issues. So this is very pertinent that you understand. We'll refer back to this over and over again. So here are some organ systems. So some of these things that we'll actually talk about in A&P. So you have the integumentary system, the skeletal system, which is going to consist of your bones, the muscular system, which is going to refer to your muscles, your nervous system, which is all your nerves. Then you have the endocrine system, which is going to deal with your hormones, which most people only know the main 2 hormones, which are testosterone and estrogen, but there's a lot more that's actually involved there, such as your thyroid, your pituitary, your thymus, your adrenal glands, your pancreas, your kidneys. Then you have your cardiovascular system, which is going to deal with your heart, your blood, and your blood vessels. And then you have your lymphatic system, and then you have your respiratory system, as well as your urinary system, which is what's going to help you urinate, your digestive system that takes down your food and breaks it down, the female and then the male reproductive systems. So, another key component that you will see all throughout A&P is directional or directions or anatomic positions. So in anatomic position, which you can see from this photo, that she is standing face forward feet face forward, as well as her palms are face forward. That is anatomical position. Anytime you refer to anatomical position, this is what it will look like. Your hands are, the palms of your hands are facing forward, your head is facing forward, as well as your feet. Now, there are different planes, which are invisible, essentially shields or planes that are going to help us figure which way we're looking at. So the coronal plane, if you look right here, it's actually dividing the body from front to back. So this is an imaginary plane that's going to essentially divide the body from front to back. That's one reason why it's running down the side here. Now, if you think about it, in Spanish, corona means crown. And I kind of think about it like a tiara. The front of the tiara is at the very front, but the back, it's kind of, there is nothing using the back there. So it helps me think of the corona being separated. Transverse is literally is separating the top from the bottom half. So imagine like someone took a lightsaber and just kind of sliced through something halfway. So it's literally a halfway point of separating the top half from the bottom half. Mid-sagittal, if you look at that word, mid means midline or middle. So mid-sagittal is a direct line in the middle, separating the left from the right side of the body, or just anything in general that has symmetry. Mid-sagittal is the middle line that separates left to right. Now, if you see something called sagittal, which is just without the mid portion, sagittal is just saying that it's dividing it from left and right. It's not necessarily equal on both sides, it's just separating left and right. Mid-sagittal is the very middle, which gives you equal parts on left and equal parts on right. And that's what you're seeing right here in the middle. So oblique is actually at an angle. And that's what you see right here highlighted. It's actually slicing at an angle, and this is what it would look like. This is essentially a piece of someone's intestines, and they've just given you a plain cut of what it would look like. So you have an oblique plane, this is what it would look like. And you might be asking yourself, why do you need to know this? Well, you'll see this a lot going forward. And also, if you're going into radiology, you'll see this as well, especially when it comes to taking x-rays or CTs or MRIs. All these planes are the ways that patients will be laying or the picture you'll be taking, even in ultrasound. So all these directional terms are something that you need to know. I invite you to learn them and study them. That's in your book. So you have anterior, posterior, which anterior means front, posterior means back. Dorsal means towards the back side of the human body versus ventral is towards the belly of the human being. So you can kind of think like a fish has a dorsal fin, which is on its back. Then it has caudal fins or ventral fins that are on its belly. Superior means that it's closer to the head versus inferior means closer to the feet. You can think about it as if you have a boss that's your superior, they're above you. If someone's inferior, they're below you. Cranial means head, and also cephalic. Caudal means toward the rear end of the tail, just like a fish. Rostral means toward the nose or the mouth. Medial means toward the midline of the body. So this is referring back to mid-sagittal. This is the very midline. So imagine there is a line running down the middle of your body. That would be medial, closer to the midline. The opposite of that would be lateral, which is going away from the midline. So your sternum or your chest would be the more of the medial portion. If we were to go outward or laterally, that'd be going towards our arms and our hands. Ipsilateral means on the same side versus contralateral is the opposite side. Deep means closer to the inside of the body or internal. So if you think about it, my intestines or my heart is deep within inside my body versus my skin would be superficial, which is the next one, which is going to be on the outside of my body. So proximal and distal, which this is what students tend to get confused between superior and inferior. So proximal is referring to it's closer to the point of attachment to the trunk, versus distal is further away. So you think of distal as distance. It is further away from the trunk. So if you look here, proximal is going closer to the trunk versus distal is further away. So if we wanted to compare someone's shoulder to the hand is distal compared to the shoulder. It's further away from the trunk. The shoulder is proximal to the hand, of course, because it's closer to the trunk. The hand is distal from the shoulder because it's further away. So make sure not to get those confused. Lateral, you see right here, it's going from the midline. So if you drew a midline in between you, lateral will be going towards the outside. Medial would be coming towards the midline. Superior is above, inferior is below. Anterior means the front of you versus posterior means the back. So, regional anatomy. So this is very, 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 very crucial. This entire chapter is very crucial, but this portion is crucial here for your time in A&P 1 through A&P 2, and actually throughout your medical professions. You will see these terms used all again and again. So the book does a nice job of breaking things down. So for the head, you have cephalic, which is the regional term for the head. You have frontal, which is your forehead. The orbital, which would be your eye. Nasal sounds just like nose, of course. Buccal would be your cheek. Oral would be the mouth, and mental would be the chin. So these you will see all throughout A&P 1 and 2. And you'll notice that a lot of these will be used in each chapter, especially in A&P 2. A lot of the bones, the lymphatic system, the cardiovascular system, the nervous system are named from these regional terms. So it's very crucial that you memorize these because you would use these over and over again. This will make your time A&P 1 and 2 very, very, very seamless and very easy. As for the thoracic, you have the armpit, which is also known as the axillary. Mammary would be your breast. Pectoral also is the chest. So that gives a reason why every time you're working or bodybuilding in the gym, we call the chest, the pecs. It's short for pectoral. The sternal region, also known as the sternum, that is where your sternum is found. Your abdomen, which is around the umbilical area. The pelvic, which is consisting of your coxal, which we refer to as our hip, and then inguinal, which is the inside of our legs going towards our private parts. And then our private parts, that region would be the pubic area. Anytime you see cervical, that means neck. Just like in the female reproductive system where there's cervix, it is cervical. That also refers to neck. So for the upper extremity, you have deltoid, which is going to be your shoulder. That's also where that muscle is located. That's one reason why that muscle is called the deltoid, is because it's in the deltoid region. Your brachial, just like you have a muscle there, that is going to be referring to your arm. Antecubital, which is the front, which anti means front, and then cubital means elbow. Olecranon, or olecranal, would be the elbow. Antebrachial, which is the forearm. Carpals, which is the wrist, which if you ever heard of carpal tunnel, that is why it's referred to as that. Manus is hand. And the reason I'm able to remember that is because in Spanish, mano means hand. And that's where it actually comes from, Latin, and that's where it comes from. Palmar, which is referring to the palm, and then digital, or like digits, are referring to fingers. Femoral, just like your femur, because your femur is located there, it's also named after that. The patellar region, which is also the name of the kneecap. Popliteal would be the back of the knee. The crural region, which is the front of your leg, also known as your shin. And then the sural region would be your calf. Calcaneal is your heel, and then the plantar surface is the sole of your foot, so that's the very bottom of your foot. Your tarsals are also known as your ankle, and then dorsum of the foot, which is the bottom of your foot, and then digital would be your toes, just like your fingers. So again, please make sure to memorize all of these because you will see these again and again and again throughout A&P 1, A&P 2, and even in your future careers in the medical field. So, body cavities and membranes. So, all your organs are not just packed into you, they're actually very well organized into what we call cavities. So, you have different cavities of the body. You have a cranial cavity where the brain and the spinal cord is going to sit. You have the thoracic cavity, which is going to be your chest, just like we saw earlier. That is where it's going to house your lungs and your heart, as well as a few other blood vessels. The abdominal cavity is going to hold your liver and your other organs, your intestines, your stomach, part of your urinary bladder. They are compartmentalized. They all have their different sections. They're not all just packed together. So this gives you a mid-sagittal view. So this is splitting you in half from the left to the right. This is giving you a coronal view, showing you if I was standing in front of the person. So here you can see the thoracic region also has other cavities within that cavity. So if you look here, the lungs have a cavity where the lungs will sit in here, as well as the heart. And you might be asking, well, why do they need a separate, compartment just for these organs? Well, think about this. Your lungs sit here and your heart sits right here. Your lungs, when you take a deep breath, your lungs expand, and so they kind of squeeze on the heart a little bit. Also, your heart is continuously pumping, so it has to be able to stretch. If those organs were all packed together and they were touching each other, they would rub against each other and cause a lot of friction. Just like you rubbed your hands like this, if you do your hands like this, it's very quickly that your hands start getting hot and they start burning. Think about if your lungs and your heart were doing that constantly, and think about how many times you breathe per minute, your heart beats per minute, and they were bumping against each other. It would cause a lot of friction and it would be very, very painful. So they all have different cavities to protect them from each other and to reduce friction. So in those cavities, they have what's called a fluid, a serous fluid, and that actually helps reduce the friction. So you can think about it as if you fill up a Ziploc bag halfway with water and you close it off, and then you stick your hand in it, just kind of like this balloon, and just stick your hand in it, and that balloon or that bag goes around your hand. It's going to feel nice and cool, but it also reduces the friction between it. So the part of the bag or the balloon that's touching your hand is referred to the visceral cavity or the visceral layer. And then the part that's on the outside is referred to the parietal. So this comes in very handy when we're understanding what part of the cavity or the viscera that's actually touching the organ, or what part is being inflamed or that's being hurt in that sense. It's good to understand what's actually happening. Of the organ, it would be your hand, and then the bag would be essentially the serous fluid and the visceral layer of the cavity. So you can see right here of how there is a cavity or a pericardium that is the light blue part is going to be actually filled with fluid, and so when the heart beats, it actually keeps it from bumping up against the lungs, which are over here, and allows it just a tiny bit time to expand and room to expand so that it doesn't cause a lot of friction and disrupt the lung function. The same thing with the lungs down here. The parietal, again, is on the outside, and the visceral is actually the lining that's actually touching the lung organ itself. And then this light blue part is the fluid that's in between there that helps reduce the friction of when your lungs inflate and deflate when you're breathing. And here's a mid-sagittal view of showing you all these cavities separating the thoracic from the abdominal. And now you see that each thing is lined with a visceral and parietal cavity, because all these organs are able to move. When you're digesting your food, they're able to move. So with these are the regions and the quadrants, or the abdominopelvic regions and quadrants. So if you've ever been to the doctor and they've asked you to point to where you are hurting, there's a reason why. So there are actually quadrants. Quadrants means quad, or 4. So if we start with this one over here, remember, if I'm looking at a person, they're opposite from you. So right upper quadrant, so if you're looking at them, it's going to be the opposite of you. So this would be their right side. So their upper quadrant, if we divide their abdomen into 4, this would be the right side, and then this would be the left side. If you see that there's 4, there's one on top, one on bottom. So we're going to say this is the right side. This is the upper quadrant. This is the right lower quadrant because it's right under the upper quadrant. This is the left side. This is the upper portion. So we call it the left upper quadrant. And then this is the left lower portion, a left lower quadrant. There we go, the name, left lower quadrant. So let's take a look and see what organs do we see here. So in this quadrant, we see majority or good half of the liver that's right here. We see part of the transverse colon and a little bit of the small intestines. Also, there's a little green organ underneath here that's kind of hiding underneath the liver. We call that the gallbladder. And then this portion right here is the part of the stomach, also known as the duodenum. So that's for the right upper quadrant. Let's take a look at the right lower quadrant. So here we see that we have the ascending colon, most of the small intestine, so part of the ileum and the jejunum. We see part of the bladder that's right here, but also usually we tend in the ER, when I worked in the ER, we kind of receive a few patients every now and then that will complain of right lower quadrant pain. So typically, if we saw a person that had this type of pain in this area, we would probably assume that's appendicitis. So right here, underneath this colon right here, there's a little bitty structure right here that's called the appendix. Some of you may have actually had it taken out before. Sometimes that little bitty organ can get inflamed and can potentially rupture, and then essentially, if it's not taken out in time, it can actually potentially kill the human. So usually when they complain of right lower quadrant pain, it's going to be referring to the appendix typically. If they're having right upper quadrant pain, it could be a sign of the gallbladder having issues, or maybe a little bit of stomach issues up here. In the left upper quadrant, we have the rest of the liver, the rest and the majority of the stomach, the pancreas, which you can't see, but it's right behind the stomach, the transverse colon, as well as some small intestines. Typically, if you're having heartburn or stomach issues, this organ here is the actual stomach. I know we refer to this whole thing as the stomach, but this is the actual stomach that's right here. Typically, if you're having stomach issues, it's going to be this region that's going to really be bothering you. In the left lower quadrant, we have the rest of small intestines, the other side of the bladder, and then over here you'll have the descending colon. Not too many issues are in this quadrant. You may have some of the pancreas if you have pancreatitis, or if you're constipated, you might have issues right in this area. But typically your most troublesome areas are going to be these upper quadrants and then this right lower quadrant. Now, those are for the quadrants, but however, we can break it down into regions. So you have the right side, you have the left side. However, there's another side. We're going to call this the middle. So let's break these words down because some of these words are a little long and difficult to pronounce. So this is the left side, of course, but this is hypochondriac region. Hypo, if you break this word apart, and this works for most medical words, if you can break the word apart, you can actually determine what it's talking about. So hypo means below. Chondriac or chondro is referring to usually cartilage or the ribs. So if you look here, the left hypochondriac region, this region is right below the ribs. So if you see the ribs right here, these are right below it. The left lumbar region, if you remember from the regions, this middle portion here is usually the lumbar. So this is left lumbar region because it's on the left side of it. The iliac region, if you remember, was right in this region on the other page, the left iliac region. And then you look on the right side, it actually mimics the same as both. So this was the left hypochondriac region, this is the right hypochondriac. Same thing with the right lumbar region and the right iliac region. Now for the middle, this changes a little bit, but it still follows the rule. So you have epigastric region. So epi means, that prefix means above. Gastric means stomach. So you put those two words together, so you see it says above the stomach. The stomach is right here. This region is above the stomach. The umbilical region, which if you've ever had a child or even after you were born, they cut your umbilical cord. Well, your umbilical cord is called that because it's in the umbilical region. That's where it gets its name from. So you can always know the umbilical region is where your belly button is. Hypogastric region. So hypo means below, and gastric again means stomach. So here's the stomach. Well, we are now below that region of the stomach. So this is the hypogastric region. So each region, if you don't know the name or it sounds too big, just break it apart and it tells you where you are and where it's at. If it's on the left side, you'll write left. If it's hypochondriac, it's below the ribs. If it's iliac, it's going to be near the iliac region. So that's one reason why it's pertinent to know those regions before you get to this section. Homeostasis. So this is a really big thing that our body is able to do, is maintain homeostasis. So homeo is referring to ability of an organism to maintain a consistent internal environment or steady state in response to changing or external conditions. So homeo means same. So here is an example. So in this example here, it says the stimulus changes in the variable that is regulated, whether it be temperature, stretch, and muscles, or any other thing that's an outside factor. You also have what's called a receptor. If you think about the word receptor, it kind of sounds like receives, or at least the prefix does. So that structure detects the stimulus or sensory neurons in the skin, stretch receptors, and the muscle. So think about the receptor being like an antenna waiting to receive a signal. Once that receptor receives a signal, receives a signal, it sends that message to the control center, which the control center is typically usually our brain, which is our central nervous system. And then our brain is going to integrate the input and then initiates a change through the effector. So if you think of the word effect, that means it is to do something in response to something. That effector is going to bring about the change to the stimulus. So this sounds like a lot of words. So let's break this down and make it a little bit easier. So let's think about if you walked outside and it was freezing cold outside. So the stimulus would be the cold air. The receptor would be essentially like a receptor in your skin, or even the hairs that are on your skin. And they're going to feel that it's cold outside. They're going to send a message to the brain or the control center, and your brain is going to then tell your skin to tighten up. And then by tightening up, it's going to create goosebumps. That's where goosebumps comes from. Once it causes the skin to tighten up, it restores homeostasis, because that is keeping in your heat so that you're not losing heat. Another way to think about this, and I like to think about negative feedback like a thermostat. So if you're in your house and it gets too hot, let's say you have your thermostat set at 72 degrees Fahrenheit, and the temperature in your house starts to get to, let's say, 80 degrees. It's going to send a signal to the thermostat, and the thermostat is going to come on, and it's going to blow cold air until it gets back down to 72 degrees, and it restores it back to 72 degrees. So this is the exact same way our thermostat reacts, just like our body reacts. So this we refer to as negative feedback. Negative feedback is essentially when something happens and then your body brings it back to normal. And we want that to happen. We don't want us to get too hot. So if we get too hot, we start to sweat. That's going to absorb more heat, which cools us off and brings us back down to our regular body temperature. That would be an example of negative feedback. However, we have something called positive feedback. And positive feedback is essentially reinforced to continue the same direction until a climatic event occurs. So here is an example. So the stimulus, so when a baby is suckling on the mother's breast, there is a central receptor in the skin of the breast that detects that the baby is suckling, which sends an impulse to the brain, or more specifically the hypothalamus, which is going to signal the posterior pituitary to release a hormone called oxytocin. When it releases oxytocin, it actually goes back to the breast tissue, and it causes milk to be ejected or to be released into the baby. Also, as it continues, as it gives more milk to the baby suckles more, which causes the same thing to happen again. So again, it's going to send another message back to the brain. The brain is going to send another message to the breast to release more milk. The baby's going to suck more milk, which is going to keep building and building and building till the baby essentially stops.